luck. Take care of your heart. Okay, I'm sure you understood all these symptoms. Share it with all your friends. All these symptoms and other things. Now coming to the symptoms. Anybody can tell me what kind of symptoms they're going to experience?
Restlessness.
One important thing. I know you people can answer that.
Pain of the right
Lack of oxygen. Got it right. Pain right here. I talked to a friend of mine. He had a massive heart attack. He survived. My God, you know what, man? It's like as though somebody is going to tear my heart completely. They are going to put their hand inside, dig out my heart. That is the kind of pain he was experiencing. Severe pain. Right? And also shooting pain around the left side. You can go left side, left shoulder, back side, jaws, teeth. I had to put a couple patients. Pain in the teeth. I couldn't see anything. Well, I had to refer them to an MD. Sure, they had heart problem. Then the next one is somebody said sweating. Yes, they sweat profusely. Third thing is nausea, vomiting. The unfortunate thing right here is, hey, you know what? I had kind of a funny feeling in my stomach. I don't know if it was nauseating. Well, it's okay. I just took something. Please don't do that. You won't know. My own brother-in-law, he said, I told him he had a heart attack a few months back. You know what? I was walking. My chest was kind of right in the center. It was hurting. Hey, Prasad, you know what I did? I just rested for a minute. I was fine. I'm perfectly fine. That's not going to work. Okay? When you talk about the pain, there are certain warning signals. Signal number one, they will experience some kind of a pain. Unfortunate thing is they're going to ignore that. Okay, again, please share it with your friends, family members. If you experience pain, don't take it for granted it's going to go away. I tell you, they can help themselves just by seeing the doctor. Now, again, coming to the pain, 2 types. Just going to keep it short. What is my time frame?
Well, it's 14 and counting. 14 minutes and counting.
You want me to stop it at 15? I can stop it. Or I got a few little things I can wind up.
Yeah.
Okay? The thing is, we call it as a stable angina, meaning they are walking, they develop pain, they rest, pain ceases. That's called as angina means pain. Alright? So it's called as a stable angina. Then if you have a stable angina, then you need to have unstable angina. Meaning, even in spite of rest, pain is not going to go away. They are sleeping, they experience pain. That's not going to go away. Okay? This is very, very, very important. If you again, your own family members, friends, if they kind of share this experience, just catch their neck, pull them, just take them to the doctor. We call it as 911. 911 is an emergency. If you see my hand out, you say 911. In US, 911 means emergency, that's it. Any kind of emergency call, I tell you, you can get help just like that, within a minute or two. And I don't know whether you have such facilities here. It could be any kind of emergency, not only medical, somebody breaking into your house, any kind of emergency.
The number doesn't go there.
No, we have 108.
108.
108.
Number is there. Only there is only number. No,
That's what I was told.
always against.
We help ourselves.
Don't hurt yourself. Please don't do that. So these are the symptoms of heart attack. And again, I just wanted to share with you, I keep noticing, and the last thing I want to share with you folks, it is kind of alarming, I don't mean to scare you. 2 points. Point number 1, I did mention about waist size. Anybody can tell me what is an ideal waist size? Anybody here? What do you think? What is the number?
32.
Magic number?
32?
32.
32 for who?
That's what I want to know.
I'm not 32. Close by. The latest thing is, I had to kind of put a sorry figure right here. It was 38, now it dropped to 35 for men. 35 for men. 30 and below for women. It was 32.
Depends on height, right?
Good. I'm right there, friend. I'm right there. I'm right there. Having said this, there is a confusing affair. How about you people? You are aware of this guy, Shaquille O'Neal? He's a basketball guy. He's a monster. He's 7'4", and he weighs about 238 pounds. Come on, don't expect him to have size 34 or 35. He's a big guy. So the rule of thumb is height in inches. Let me repeat it. Height in inches divide by 2, half of it. That should be an ideal waist size. If you are more, work on it. No choice. Second factor I would like to bring it to your attention. This is an unfortunate thing. The rate of heart disease among Indians has gone up like anything. Can anybody tell me what the reason behind the whole thing?
Family pressure.
Lifestyle, new lifestyle.
ICP, peer pressure.
We probably had it all the time, now
Changing
we're
of
getting to know about it.
Changing like that.
Okay. The answer is, I think you will know this. The size of the blood vessel for we Indians is relatively small, very small. Compared to, if I had to compare myself, somebody bigger, somebody okay, locals, Americans, they are pretty big people. Size of the blood vessel is relatively small. Teeny weeny bit, it clots up. That's the reason. Teeny bit of plate collection or a clot bursting or whatever it is, that thing is not attack. So, what is the solution for this? What is the solution for this? Again, folks, I don't want to take your time. If anytime if people tell me, I'll just close it up. I don't want to take your time. Where is the president?
Dial GOD to change the DNA.
Drink a lot of water to make your blood. That's the thing.
Drink more water.
Come on, guys. One important thing I want to give you some
Exercise.
Yeah, I have to give all the candies to everybody.
Yeah.
Change the lifestyle. Very simple.
Do regular exercise.
Change the lifestyle. Change the lifestyle. Change the lifestyle. Again, when I talk about changing the lifestyle, what is it? Let me ask you, how many vegetarians here? Raise your hand. How many? Oh, you see a lot of vegetarians and the rest of them meat eaters. That's fine. Just want to keep it simple. Again, I heard this from the doctor, an Indian doctor. He specializes in heart disease. Just going to keep it very simple. Breakfast, he says, try to eat, do not eat any fried food, dosa and other things out of the plate. Cereal is good, okay? And you got to follow it up with the fruit, right? Assume you have your breakfast at 8 o'clock in the morning. You should eat so much breakfast, it should carry on rest of your day, meaning a very, very, very heavy breakfast. Keep that in your mind. Very heavy breakfast. 8 o'clock you are going to have a breakfast with a fruit. Do not use any fried food or anything as such, something good, healthy. Say, I assume your blood sugar level keeps kind of going up and down throughout the day. I'm sure people must have experienced your fun and all of a sudden, boom, man, I'm hungry. If you get that feeling, all of a sudden I'm hungry. Why? The blood sugar kind of dips in. So the recommended thing is just to maintain the blood sugar level, say a couple hours later, or even 2.5, 3 hours later, just take an apple, that will take care of it. 11 o'clock. And if people are used to having their lunch around 1 o'clock, make it again lot of vegetables. I'm a vegetarian. Or even some rotis. For those who eat meat, like a piece of chicken, excellent food, excellent source of protein too. And I'm a type of fellow, I shy away from rice. I don't want to eat rice. Both my wife and I, we are determined no rice in our menu. And try to come up with a rice substitute or whatever it is. So again, 1 o'clock and now 3 o'clock, 4 o'clock, maintain the blood sugar level. You try to go with some snacks. We have crackers. You get crackers here?
You do.
You do?
We call them biscuits.
Biscuits, whatever it is. Maybe a cup of tea. We call it crackers. Have that around 4 o'clock. Mind it, something that's going to be healthy. Then dinner should be, you don't call it as a dinner, it should be a supper. What happens is, you won't be that hungry to eat having your supper so before 7 o'clock. Right? And you cannot eat heavy. The whole concept here, ladies and gentlemen, you're going to start with a heavy breakfast that should carry on the rest of the day. And you're going to supplement rest of the things, small little things. Somebody mentioned 6 meals a day. Absolutely, this would be 6 meals a day. Now the last but not the least, I'm not yet through. If you finish your supper around 7, ideally speaking, mind it. Give yourself rest for about an hour and a half, then get your workout. Get your workout to such an extent you should be practically sweating. So what's going to happen when you work out?
People burn all the sweat and
Heart rate increases.
Right? What's going to happen? One quick answer.
Burn out all the fats you have accumulated the whole day.
Burn your calories.
There you go, sir. You said it right. I had to toss you a big apple. How about that? Something healthy. Here you go. Practically go to bed with empty stomach. That's the whole concept. You burn out everything. When does the tummy starts? I'm going to eat heavy dinner with a lot of rice, pasta, whatever it is around 9:30, 10 o'clock. Next thing is I'm going to hit the sack. I'm really pooped out. Good enough, friends. Fat needs to collect. Where does it collect mostly? Here, another pack. This fat collecting in the front of the area is terrible. I tell you, waistline, remember my words. So change your lifestyle. Help yourself. Work out good. And it will help you, sure. Last but not the least, last point, that does not mean to say I'm not going to have an heart attack. We don't know. At least there are certain things, thank you, we are going to prevent it. Mr. Postmaster.
Thank you, sir. Let's give him